Incoordination, also known as Asynergia, refers to jerky, inaccurate, and non-purposeful movements performed by groups of muscles. Coordination is the smooth, rhythmical, and accurate activity of muscles working in the correct sequence. When this is lost, movements become incoordinate. Incoordination can result from several causes, including flaccidity, spasticity, cerebellar ataxia, and loss of kinesthetic sensation. Each cause affects muscle control and movement in different ways. Flaccidity results from lower motor neuron lesions, leading to muscle paralysis and weakness. Spasticity is caused by upper motor neuron lesions, resulting in increased muscle tone and abnormal, uncoordinated movements. Cerebellar lesions cause ataxia, leading to hypertonic muscles, swaying gait, loss of muscle teamwork, and symptoms like dysarthria, intentional tremor, dysmetria, dysdiadochokinesia, and nystagmus. Loss of kinesthetic sensation leads to neuropathic joints, also known as Charcot's joints. This condition is seen in diseases like tabes dorsalis, syringomyelia, leprosy, and diabetes mellitus, resulting in loss of joint position sense and incoordination. Tabes dorsalis causes sensory ataxic gait and loss of proprioception. Syringomyelia leads to progressive sensory and motor loss. Leprosy causes skin changes and nerve thickening, leading to sensory and motor deficits. Diabetes mellitus can result in peripheral neuropathy and proprioceptive dysfunction. Several clinical tests are used to assess incoordination in the upper and lower limbs, including the finger-nose test, finger-to-finger test, rapid alternating movements, finger-toe test, Heel-Shin test, and Romberg's test. Correction of incoordination due to flaccidity involves strengthening and endurance exercises. For spasticity, treatment aims to reduce muscle tone using stretching, PNF techniques, and spasticity-relieving exercises. For loss of kinesthetic sensation, Frenkel's exercises are used to improve joint sense and coordination. In cerebellar ataxia, the focus is on improving trunk stability and balance through specific training and exercises. Frenkel's exercises are specialized for sensory ataxia patients. The key principles are concentration, precision, speed and range, command, repetition, and complexity. These exercises use alternative sensory mechanisms like vision, hearing, and touch to compensate for proprioceptive loss. Patients are positioned to observe their movements, usually in a half-lying posture. The exercise program progresses from supported to unsupported limb movements, touching marked spots, and increasing complexity as the patient improves. Frenkel's exercises can be performed in lying and sitting positions. Movements include abduction and adduction of the shoulder and hip, flexion and extension of the wrist, elbow, knee, and hip, as well as coordinated tasks like touching marked points or the therapist's finger. In sitting, patients perform alternating movements such as supination and pronation, flexion and extension, and functional tasks like combing, drawing, or transferring objects. Lower limb activities include unsupported foot placement, sit to stand, and walking on the buttocks. Standing exercises begin with support and progress to walking with parallel bars, using a wide to narrow base. Frenkel's mat is used for walking skill improvement, including swing to and swing through gait, sideways walking, and pivot turning.